Hi, my name is Sally Garcia, and this is my assignment of capstone and 5-year presentation through Lamar University. First, I'd like to start with my professional bio sketch. I've been a registered nurse since 2016. I was a licensed vocational nurse for 1 year while studying for my RN in the ADN program. I am currently completing my baccalaureate degree from Lamar University, and my anticipation date of graduation is May 2018. I received my first job as an RN in the operating room for a hospital in Houston, Texas. I am still currently working as a nurse circulator in the operating room. I am certified in basic life support by the American Heart Association, and I plan to continue my education to achieve my master's degree from Lamar University. First, I'd like to start off with the first construct, which is humanities and society. The outcome is practices safe and effective holistic patient-centered care to a variety of patients, clients, and multiple settings from a global perspective by incorporating theories and evidence-based findings. I found this in class Nursing 4316, Comprehensive Holistic Health Assessment. It discussed holistic health assessment across the lifespan in pediatric, adult, and older adult. My assignment was the system assessment and questions through shadow health, and that I had to explain the relationship between holistic health assessment and the nursing process through shadow health patients assessments that I had to do, and I was able to successfully navigate through various learning channels of illnesses. I believe this objective was met at 100%. The next construct is lifespan health continuum. The first outcome was supports patients, clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. I feel that I found this in class Nursing 4620, care of patients with compromised multiple health states. I found that on the assignment of the community-based service learning assignment, which included a PowerPoint presentation. And for that, I had to identify a person and interview them about their disease process. I had to reflect on that compromised patient that I had cared for. I discussed the patient's disease process and found resources in my community that benefited my patient. I also had to develop a PowerPoint presentation as part of my community-based service learning assignment, and I feel that this objective was met at 97%. The second construct is evaluates patient-centered care for patients and clients across the lifespan based on common and complex health needs and compromise multiple health states when considering multiple determinants of health. And I feel that that outcome was met through Nursing 4540, Care of Communities. The assignment was a practicum, project, teaching plan, and video. And for that, I had to develop a project that helped me identify a program that addressed civil needs, pride, and learning the diversity of the community. It assisted me to improve my presentation skills because I had to present a teaching video online in a professional manner, and I feel that this objective was met at 95%. The next construct is evidence-based practice and clinical reasoning. The outcome synthesizes clinical and judgment in nursing practice utilizing critical thinking, the nursing process, research, and evidence-based practice. I feel this class was met by Nursing 4390, Nursing Inquiry, and Evidence-Based Practice. The assignment was our critique of a quantitative research article. And for that, I had to critique a scholarly article and evaluate and utilize the research in nursing practice by analyzing the validity and the quality of evidence used in the article. I was able to learn about the principles and measurements and data collection. I feel that this objective was met at 98%. Next construct was patient-client-centered care, and the outcome employs safe, effective patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and the intraprofessional healthcare team. I found that in class 4580, Synthesis of Professional Nursing, and the assignment was the Lewis Blackman Story Practicum. And the Lewis Blackman story is one I have seen before through our safety meetings from my current employment. This practicum assignment helped me to analyze the Texas Nursing Practice Act with regards to the legal and ethical elements of professional nursing in the state of Texas. And it helped me learn the escalation process to avoid incidences like Lewis Blackman from reoccurring in the future. And I feel that this objective was met at 100%. The next construct, there's two for professional roles. One is differentiate, the outcome is differentiates multiple role dimensions and practice with ethical, legal, and regulatory parameters when caring for patients, clients as member of the interpersonal and intraprofessional and interprofessional healthcare team. And I feel this was met through class Nursing 4550, Leadership and Management in the Healthcare System. The actual assignment was the Leadership Style and Qualities paper. I had to compose a paper with regards to an effective leadership and qualities by my leadership philosophies. I chose to write about my views as my hospital handled the Hurricane Harvey flood outcomes and how it impacted our leaders in my unit. I learned from that situation to improve my leadership and abilities moving forward in the future. I believe that this objective was met at 96%. The next outcome was demonstrates professional integrity, effective communication, active inquiry, and service to the community. I feel that this was met through class Nursing 4321, Nursing Theories and Online Education. The assignment in particular is the philosophy paper, and for that particular one, I had to compose a paper to explore my own philosophy of nursing practice and use my knowledge gained from the nursing theories and theorists. I had to compare and contrast my views with different theorists in order to prepare my paper for an A. I believe that this was met at 100%. Now I have reached my 5-year career plan. I plan to complete my master's degree in education from Lamar University. I would like to become actively involved in more organizations to include American Nurses Association, the National League for Nursing, and the National Association of Hispanic Nursing. I plan to obtain my CNOR certification, continue working with my current employer, or possibly seek other avenues of nursing. I am interested in the teaching as an instructor, possibly nursing, school nursing, or ambulatory surgery center nursing are some of my pathways for my future. And here are my references. Thank you.